Hi there, Allegra here. In this case, I will talk about obstructive sleep apnea. Obstructive sleep apnea, it's a very serious condition where a person stops breathing for 10 seconds, 30 seconds, 1 minute, 2 minutes, sometimes 2 minutes and a half, because there's an obstruction in the upper airway. The upper airway can collapse in 4 places. The soft palate tissue can collapse, the tongue can collapse, the epiglottis can collapse, and the whole throat itself can collapse. That's why this person will snore. Snoring is a sign there's an obstruction in the upper airway. Bear in mind, a good airway has the size of the tongue, and a poor airway has the size of a barrel. So you can imagine the level of stress the body receives and also the brain. In some situations, it can happen also what we call paradoxical breathing. Paradoxical breathing is when we breathe in and our diaphragm goes up, and when we breathe out, the diaphragm goes down. So it's the opposite way of the functional breathing. When we breathe in, the diaphragm goes down, and when we breathe out, the diaphragm goes up. So paradoxical breathing is also a high stressor for the body and for the brain. From the biochemical point of view, we will see levels of CO2 and oxygen dropping, and the body needs to activate other mechanisms to balance this disorder involving our kidneys. Well, it is a very complex situation. I will not go into that for this video, but to make you figure out what is going on there, right? If we are suffer from this condition. In my case, I suffer from obstructive sleep apnea most of my life, and I addressed this condition doing breath work, improving my sleep quality, and taping my mouth during night. Taping my mouth with this myotape helped me a lot. You can use this myotape, or you can use also a surgical tape. In the beginning, I didn't have these myotapes, so I use a surgical one. Just cross your mouth with that surgical tape and go to sleep. You can rehearse using these tapes during the day. The idea is to be nose breathers all the time. Don't use your mouth for breathing at all, except in certain conditions. For example, in martial arts, we use kiai, or if you practice Wim Hof method, but I will not recommend you to practice Wim Hof method and going to hyperventilation if you suffer from obstructive sleep apnea. I think also Wim Hof will agree with me. Some physicians and scientists and medical doctors treat obstructive sleep apnea as a sleep disorder. In my opinion, obstructive sleep apnea is a sleep disorder, but also a breathing disorder, because as we breathe during daytime, we breathe during sleeping time. So in order to have a better sleep quality, I will suggest you to get sunlight during the day as much as possible, especially when you wake up. Get some sunlight into your eyes, no eyeglasses, and 10-15 minutes have a walk outside and get sunlight, and follow some sleep hygiene. try to set up a time for sleeping and try to stay as far away as possible from computers and devices at least 1 or 2 hours before you go to bed. And also it's good to stop eating 2 hours before you go to sleep. From a Buteco perspective, obstructive sleep apnea is a breathing disorder, so I will recommend you to practice some breath work to reach slow breathing, and also some myofunctional therapy. What I am doing, I am still doing myofunctional exercises. I will share with you breathing exercises and myofunctional therapy exercises on next videos. But the idea is to strengthen these tissues and muscles, especially the muscles, because that's why they fall down into the throat. They are very weak. And for singers, classical singers, jazz singers, whatever, pop singers, if you are a singer and you suffer this condition, those muscles will not work for your voice technique. They will not work. So it is better to address this condition first and then try to practice your singing exercises or whatever, or you can do your singing voice exercises during you are addressing this condition. So I wish you can find a way. If you are snoring, if you wake up feeling exhausted, or you wake up feeling you didn't have enough rest, your mouth is dry, your throat is dry, if you have to use the toilet during the night, these are normal conditions. So check with your physician or medical doctor if you are not suffering from obstructive sleep apnea. And last thing before I finish this video is I highly recommend you this book, Why We Sleep, written by Dr. Matthew Walker. Dr. Walker is a professor of neuroscience and psychology at Berkeley and also a former professor at Harvard University. And in this book, which is a wonderful work about sleep, he is considering sleep stages as highly important in order to prevent mental diseases, depression, impaired health conditions. It is important to have a REM stage and deep sleep stage, to not be only a light sleeper. And this is really important. Nowadays we have a lot of information about nutrition, about exercising, but I don't know what's going on. We don't have much information about sleeping. And when we suffer from obstructive sleep apnea, we have a sleep fragmentation, and sleep fragmentation is so bad for our brain and our system. So I wish you found this content useful, and see you on my next video. Please hit the bell and subscribe to my channel if you find this content useful for you. All the best, all the health, and all the awareness and all the gratitude in your life, and see you soon. Thank you very much.